Hi, this is Jessica DeMassa at the HISA Studio here at HIC 2017, and I'm here with Guy. Can you please introduce yourself for everybody watching?
Hi, my name's Guy. I'm the MD at Wave Digital, and I'm here at HIC talking to you.
Fantastic. So tell me about Wave Digital. What are you working on right now?
Wave Digital is a digital innovation company specialising in design and development of bespoke app solutions for the healthcare industry. We're working on a number of patient experiences apps. One of them I can tell you about is down in Peter Mac in Melbourne at the Comprehensive Cancer Centre. I'm trying to improve the treatment and journey a patient goes through in cancer down there.
That's fantastic. And so so you guys are developing for healthcare systems, or are you helping startups? Like, tell me a little bit about the work that you're doing. Who's your client?
Okay, our client is both ends of the spectrum, so large-scale health organisations like Peter Mac, so they're a large hospital, but all the way down to smaller startups. We work with a number of small startups and trying to help them find product market fit and traction with their products. I guess a more well-known one now that we've been working with for about 5 or 6 years is Real-Time Health, or Healthily, as they've recently rebranded.
Okay.
And
very good. And so what are you seeing as some of the trends here? Is there any particular type of technology that seems to be really hot right now that people are looking to have apps developed to utilize?
Yeah, look, I think a lot of people are trying to leverage and find out what's going on in the world of machine learning and data analytics. And we see a lot of customers coming to us saying we want to do something in this space. But I think where we end up with most of our customers is actually just helping them put the patient or the clinician at the center of the problem they're trying to solve. So we like to start with a people-first approach to development and really understanding the needs, and then using technology to support them with their needs. And so really establishing context of use first, and then the best technology will naturally bubble to the top based on that.
So healthcare is obviously, it's so complex because there's so many players, and you have the patient, you have the provider, you have the health system, you have the government. So tell me, when you're looking at creating a solution that will, streamline the processes and cater to all audiences, what's your best advice for an organization that wants to walk into something like this?
Yeah, look, it is a complex ecosystem, far more complex than most other industries. But I think the best advice is to try and keep it simple and know that you're not going to come up with a solution that is 100% the best solution in the first iteration. So know that you've got, give yourself some time and budget to start small and iterate your solution to the best possible solution over time. That's
some good advice. Start small, pilot maybe, just to try to see how things work, to learn.
And to learn, yeah, definitely. So always putting your assumptions, measuring your assumptions. So putting assumptions to one side and saying, okay, this is what we're assuming in this project, and then trying to test those assumptions in your pilot, in your small scale trial, and then extending and expanding based on learning.
Last question for you. As a technology company, what are you most excited about for the future of health here in Australia as this digital revolution starts to unfold?
I'm most excited about being able to share information between different aspects of the healthcare system. So technology will absolutely be miles ahead of where the healthcare system is at the moment. So if we can get the system up and better, then all these amazing advances in AI, machine learning, wearable technology, all these different things, then they'll have a spot and a use. At the moment, a lot of these amazing technologies is really hard until we get the underlying foundations to support that.
Fantastic. Well, thank you so much for joining us and for sharing your perspective with us here at the HISA Studio at HIC 2017.